Thanks, everyone. It's really a pleasure to be here with you this morning. And I was invited to come and talk about AI and ethics in healthcare. And so I was just giving you a teaser here of what this talk will be about, which is a little bit more focus on the kind of intelligence that I think sometimes the artificiality might, in fact, preclude us from accessing. And I also just thought maybe this morning could be about a provocation and a way to get you all twisted up and upset and maybe anxious and stressed, so that we can, in fact, move toward the questions and the provocations and the answers that we really so desperately need, all of us. So let me just tell you a little bit about myself and how I got to this work. I have a Ph.D. in library and information science from the University of Illinois at Urbana-Champaign. I have focused all of my work, I really kind of got to this field of thinking about technology and society by way of thinking about what does it mean that it's so difficult to preserve knowledge and transfer knowledge and pass on knowledge. And of course, people who come from the field of library science are especially concerned with humanities knowledge and how do we preserve it over the time span of, let's say, 1,000 years, 100 years, or more. So I was very interested in this new kind of upstart company that libraries were getting excited about when I was in grad school, called, you might have not ever heard of it, it's called Google. And it was so interesting to see how many people in the knowledge and information space and fields were thinking that they had to move and model so much of our knowledge preservation work around what Silicon Valley was doing, and how they were, in fact, borrowing the longstanding citation practices, for example, that we use in academia to signal the validity or not of things on the web. But more importantly, I was noticing that the public was moving away from trusted knowledge experts and just Googling it. And so that was really what led to the book, Algorithms of Oppression, which was a very long and detailed and, well, it's a book you don't read at night before you go to bed. Okay, I'm just gonna say it's like a weekend Saturday read kind of thing. But I was, I wrote that book, and it's all of the reasons why we shouldn't just Google it and why we shouldn't just trust these large-scale digital media systems for very important information and knowledge transfer. And part of the root of that work and concern was really about the kinds of biases that we already knew were baked into knowledge and information systems, starting with things like the Library of Congress subject headings or the Dewey Decimal System. I mean, anybody here under 40 is like, what's that? But the rest of us with gray hair, this is all gray hair under here. Don't let this stifle you. We knew that, in fact, these systems were full of societal concerns. I mean, blatantly racist and sexist kinds of language and classification schemes. And so I've been concerned with the underlying logics of the kinds of systems that seem invisible, that are also incredibly boring, because I think that it's in the boring and banal where the magic happens. I feel like that should be on a t-shirt. But I was not the only one who was thinking about this. So my colleague, Julia Powles, who's now at UCLA, was also, during those years, I finished graduate school in 2012. I was writing about this in, I guess, as early as 2010, 2011, 12. But across the way, across the Atlantic, Julia Powles and Hal Hodson were writing about what was happening with Google and DeepMind and their kind of takeover of the national healthcare system in the UK. And this was one of, we are a decade later, truly, still grappling with large Silicon Valley companies kind of encroaching upon incredibly sensitive, important data and knowledge about us. And what's more difficult, as it was a decade ago, is that these players are so large and so aggressive that it's difficult for us to even imagine doing our work without their kind of backbones that they're providing. Of course, in the UC, I'm in the Department of Information Studies at UCLA. We were the only department at UCLA who wrote a letter of protest about the UC moving its IT backbone to Google. We were literally, it was like 14 nerds who really knew what the consequences of that would be. And so, now we are deeply embedded with all kinds of systems across the UC and beyond, where the major tech companies are really having access at an unprecedented level to public data and incredibly sensitive data. And so I'm going to talk about what I think the stakes of that are. Certainly, alongside that, we have algorithmic decision-making systems that are embedded across all kinds of industries now, and that are deeply consequential in both life or death decisions that are made about people, whether they go to prison or not, whether they are first in line for a vaccine or not. I was just sharing with one of our colleagues earlier, I just anecdotally reminding about when the COVID-19 vaccine came out, and Stanford University Hospital, you probably remember this story, had to make a decision about who would get the vaccine first. Their algorithm, of course, sorted for people who were over 60, who were elderly, and it just happened to be that most of them were emeriti faculty who were at home and were not working in the hospital. And so the frontline workers were screened out of the COVID-19 vaccination kind of first batches. So those kinds of things in terms of what are the models, what's the underlying logic of a model, what's the data that's used to train a model, and where are those models working to really over-determine what is possible for people and for society. These are the kinds of things that I wake up every day and talk about and work on and research. And of course, you can imagine that makes me, not the person you want to sit next to at a dinner party. It's just really terrible. All right. We also are seeing these headlines all over the news about, newer developments in AI and the way in which it, for example, is biased or discriminates against different language groups, including, Americans, African Americans, or that is making decisions or predictions based on dialects. And I think that these are the kinds of things that we could have looked at a decade ago and saw the writing was on the wall that these things were happening in other systems. But now we know, and we could spend a whole day just talking about what are the logics underneath how these models get trained, what's the data they get trained on, the content moderators that are adjudicating content across a lot of different kinds of systems. They get it wrong. The way that software is used, of course, data labeling and things that go terribly wrong in that. And I'll talk a little bit about that. But when we start talking about large language models, we're seeing even worse kinds of results, or at least similar to the kinds of things that I saw when I was studying search engines. And some of these things, this was a great story that I put the citation here that you might want to check out about things like lighter or darker skin tones and how large language models relate to them. And of course, the way in which they ascribe certain kinds of values to people. In this study, it found that images for high-paying jobs, when you were looking in a large language model and asking it to generate images, higher-paying jobs or higher class status occupations were ascribed lighter skin tones, or white people. That's really what it's saying. And darker skin tones were ascribed to things like fast food workers or social workers. So these are the kinds of things that I think are often under the hood that people who at a surface level use different kinds of technologies at the interface level might not ever think about in terms of how do these models work, how have they been trained, and these are incredibly important. My friend Deb Raji at UC Berkeley, she worked on a very important paper called Gender Shades with Timnit Jabru and Joy Balwamini. This study, Gender Shades, was very important in helping us understand facial recognition systems and the way in which they are racially biased and have the least recognition or have the highest failure rate on darker melanated people, especially Black women. And that Gender Shades paper has had a big impact on the industry and facial recognition technologies. But Deb has gone on now to study things like how data labeling has had a tremendous impact on things like vision, AI. Here you can see in this image, this is machine learning now. When a machine is labeling automatically data that is fed into it. Both of these hands are holding thermometers, but the machine learning algorithm recognizes the Black hand as holding a gun and labels it as such, and then labels the white hand correctly as holding a thermometer. So these are the kinds of things, again, that I think are incredibly concerning when we pull these out-of-the-box kinds of technologies and use them in our business and personal lives. Of course, bringing this closer to home, and I think Dr. Singh is here, who is one of my heroes in this field, who I feel like is really more qualified than I am to speak about failure rates of AI in the field of medicine. Medicine is not my area of specialization, but that we have a kind of a twofold problem of both large language models being used by professionals in diagnostic ways, but we also have the public self-diagnosing through its use of lots of things. I know I'm not the only one here who has a Ph.D. in WebMD. But I will tell you that for sure, in the times when I didn't have good health care, that the internet was my doctor. And I know plenty of people today for whom that is the case too. And we don't have to be embarrassed. We're just doing our best. But imagine what this means then, of course, for the public. And of course, these are then structural problems that the sociologist in me also writes about. Like, what does it mean that we live in a country where healthcare is privatized, where it's increasingly difficult to access? Of course, we've seen what's happened to Medicare, what happens when politics completely decimate our social safety nets that were already so thin and delicate in this country. And then what does that do? Well, that forces more people to turn to digital systems to try to make sense of their lives and their health. I put a big red mark out on this because there was a moment under the Biden administration where we were starting to get some regulatory traction in the United States, and that's all gone. So I'm just going to skip over this slide. I used to talk about this, but there's no point because that's all over. And that is troublesome. So the question then to me is, how do we bring complex intelligence to AI-driven healthcare, which I think is a little bit different than how do we think about AI healthcare ethically. I think we want to always keep the humans in the forefront of the complex intelligence that we need in healthcare and other systems. So I've recently started collaborating with Donald Martin. He's formerly of Google, which is about the most hilarious thing that the universe could do to me is to pair me up with a former Google executive. But I really enjoy Donald's work, and I wanted to bring your attention to it because we are spending now a lot of time thinking about what does it mean for people, for communities to participate in the AI infrastructure. So you saw all of the kinds of things that are part of the current infrastructure. What does it mean for communities to actually be able to participate in building AI infrastructures that are directly beneficial back to them and their communities, where all of the knowledge and societal context that's missing from AI systems is something that communities can themselves hold on to and keep control over, which of course is the part of AI development that the big tech companies are the least interested in. And I find that so interesting that it's very expensive to get forensic on people. It's much easier to do kind of mass aggregation, unless you have $1 billion from the federal government, let's say to Palantir, to get forensic about immigration. Then we see where the resources are distributed. But here's a kind of an example. Each of us is kind of living, here we have, kind of this image of a Black woman who has many, many factors that influence kind of her social context. She's Black, she experiences racial discrimination. She might be single, she might be mom, she might be Christian, maybe she lives in a red state, maybe there's issues around healthcare access, childcare costs, maybe she votes Democrat. Well, we know she votes Democrat. It's not even a maybe. She's an HBCU grad. She experiences gender discrimination. Obviously, she's also getting paid 60 cents on the dollar, 66 cents on the dollar, the wage gap. She's got student debt. And these are all factors that might be part of this specific person's experience as they walk into a healthcare situation. Now, we've done some modeling. Donald's done some incredible modeling, especially with respect to things like racial health disparity. And one of the things that we know, for example, is that AI developers are often using proxies to represent the complexity of all that is her, right? So they might use a proxy like how much she spends on healthcare as an indicator of like her, whether she's getting good access to healthcare, or, the more she spends on healthcare, that might be a proxy for the better solutions that might be suggested to her, right, in a healthcare situation. It might signal that she's invested in her health, and so she's someone that a healthcare system might take her more seriously, just by virtue of the fact that, let's say, she has insurance compared to someone who doesn't. Unfortunately, these factors also are part of the reason, for example, especially things around like wage gap, maybe that she's a single mom. Those things might be factors in why she doesn't spend as much money or resource on healthcare, right? Maybe she's neglecting to take care of herself or get into those doctor's appointments because she's got the whole world on her back and she's handling a lot of business. And I can attest to even being married, that might also be the case too. So these are the kinds of things where the proxies really are insufficient in the way the AI models are built. And these are the kinds of things that can lead to racial disparity. And we've been working together now to study and understand what it means that when medical algorithms, for example, favor white patients over sick or Black patients. This is like a personal issue for both of us. But we also know that it's very difficult to intervene at the level of like the systems that are getting adopted by healthcare systems in particular. So this is one of the reasons why this research is so important, and we're really open to talking to others who are working in this area. Here's kind of an example of what I mean by the proxy spending on healthcare, right? So the assumption here, let's say, is that the more you spend, that this is, on your complex healthcare needs, that, this somehow would flag you in a system. And yet all of this other societal context is missing. So not only that the healthcare has structural inequities, you may not get to access to the best doctors who are willing to recommend you. You may not get the best notes taken about the problems that you're reporting, right? All of the kinds of things. You may just not have access to healthcare at all. We know those things increase things like underdiagnosis. We know from long histories of medical experimentation on Black communities that there's a weakened trust, a serious lack of trust in some cases on some issues in the healthcare system writ large, which would also keep people from coming and engaging. There's the racial wealth gap, which impacts your ability to engage in care. And all of those things really lead to decreased spending on healthcare. So if healthcare, again, spending is the proxy for being flagged for better healthcare, then we're in trouble. And this is just one example. There's just like so many ways that we could model the societal context that's missing from patient care. So Donald and I are working together now to develop what we're calling the Equitable AI Underwriters Lab, which is really a way that we can do more social context modeling around important problems and have communities be able to participate in developing the knowledge that's needed to, in many cases, probably signal that what the answer is not AI to solve their problems, but in fact, other kinds of structural and social interventions. So some of the things that I think we can do around this is think about bespoke small expert models with local control rather than, and I had a chance to speak with the chancellor here at UC San Diego, and one of the things that I was really heartened by was the fact that he was not interested in turning over the AI backbone to OpenAI, but rather to think about how does UC San Diego develop its own models. And then I was like, could you come be our chancellor at UCLA? So that probably isn't going to happen, but I'm just saying that that's the kind of way we need to be thinking, especially for those of us in the UC system. We are public institutions, and I think that we have a job to be pointed toward the public good. And so this is one of the other provocations that I really I just could have never imagined that I would have the honor to get to speak to a room full of people who are decision makers around the way that our public institutions will operate and move with the public. But the public good and our public institutions are massively under attack right now. I mean, this is not a secret, not only as scholars. I mean, I was sharing, Amy and I were lamenting that probably our work is illegal now under the Trump administration in terms of its focus on equity and inclusion and care for social justice. But the truth is, we are one of the most powerful public institutions in the world, and certainly in the United States. And so the decisions that we make are so incredibly important. And I know for a fact from spending a reasonable amount of time in Sacramento that the technology companies are constantly looking for opportunities to transfer public wealth from public systems and institutions into their coffers. And so we need to actually think again, and I point back to Julia Powell's early work in 2017, what does it mean when we turn to these companies to be the backbone, and how does that make patients and the public vulnerable? I think we also know that there's incredible data exposures that are happening. I was at Washington University in St. Louis a few years ago, meeting with medical doctors there, and one of the things that they talked about as unintended consequences of trying to do things like build interoperable systems and data sharing for patients across systems, both kind of like public and county health systems and the university healthcare system, was that data then was being opened up in ways that they had not intended for, law enforcement agencies, foster care systems. So where a patient might report to their doctor confidentially, well, I'm in transition in my housing and I don't have a place to live right now. Maybe I'm couch surfing, or maybe I'm precarious in my housing, that those notes then going into a system that might then be available to a social service system that then comes and takes the children away from that patient. So these are the kinds of things that are actually happening. And I would point to the work of Victoria Copeland, who has written about algorithmic predictive systems and the way in which they are pointed at women, for example, in Los Angeles who live on Skid Row, who are much more likely to lose their children, even though they have system support networks in place to care for those children while they are in transition. So that reducing those data exposures is so, so important. And I think that's just keeping a civil and human rights lens on the case and in the foreground. And then, of course, we need human beings for social and contextual decision making. In an instant, we have a different understanding of a person. I know all of us who interact with students, I don't have patience, nobody wants that. But certainly with students, we see what it's like when we think of them one way, we know them one way, and then we learn something else about them. I think about this sometimes with students who don't make it to class regularly. And then I learn, for example, that they're caring for a person who is deeply unwell. And that changes in an instant how I am ready to move with them and see them be successful in the classroom. So those are things that an AI system can't do for us. And I think that, again, it's very important that we think about that the variables, AI-driven systems need a level of stability and standardization, just writ large. But we variables in this room are incredibly dynamic and different, and we're different moment to moment, day to day, year to year. So these things are things to keep in mind. And then, of course, for me, I just believe one of the most important interventions we can have as we're thinking about this is always thinking about the balance of resource investment in technology versus people. And, when you think about $1 billion being put into a system like Palantir to gather forensic information on undocumented people, what could that $1 billion have done to help legalize people and set them up for success? So there's lots of ways to think about the way that we invest resources. So these are some books that if you're just getting into this conversation about technology and society, this is like a great summer reading list. I threw Algorithms of Oppression in there if you're interested. But all of these books, I think, you could walk away just with such a deeper understanding of the complexity. And I know it will help the work that you do as well. So the last thing I'll just say is, we now have systems at the federal level and in countries around the world that are collecting forensic level information on people in the public in the most anti-democratic ways. And of course, these are things that the government can't do because it would be illegal 7 ways to Sunday. But it is not illegal when private companies do that. And when you think about the alliances that are coming between social media companies and other kinds of data collection companies, we in the UC have also been thinking about this. I wanted to kind of draw your attention to this responsible AI strategy report that you can just search for quickly and find online. It talks about, and of course, students have also been protesting the way in which their data and is going into systems. So Berkeley's had a big student protest around this. Faculty at UCLA, we've been very animated around this. But I think it's something to keep in mind, again, because at the hyper-local level of your interface or our interfaces with these systems, we might never think about what the consequences of the kinds of data we collect on people can do to completely alter their lives. Last thing I'll say is, for those of you who train medical students, this is probably my favorite joke on Reddit right now. Your future doctor is using ChatGPT to pass med school, so you better start eating healthy. I love this. I think it just tells us some of the things we should be thinking about as we continue our work. And that's it. Thank you. We could take a few questions.
Yeah, we got some questions from the audience.
If you just want to do a deep breath, that's okay too. Listen, I'm really thrilled. Okay, here we go. Hi.
Yes, I'm thank you so much for your talk. Big fan of your work.
Thank you.
And I think one of the things I'm curious to hear you kind of reflect on and talk about is sort of this tension between accuracy and bias on the one hand and sort of privacy on the other. And you could have mentioned how some of these don't grab the context. And so if we add more data, add more cultural context, maybe they'll get better. But that requires us to do more data collection, more tracking,
That's
more
right.
surveillance. So how do you think about that trade-off?
Yeah, I think that the data collection should, and there's really smart people doing work around things like data trusts and community level control over data. I mean, for me, putting all that data in the hands of OpenAI or Google is not the way. But thinking about, and I was here last year for a similar conference and met Dr. Kalu Fox, and who's here at UC San Diego and is doing a lot of really interesting work around indigenous models of knowledge control. And so I'm really curious and interested in that kind of work. And we do that in libraries. We also think about not all knowledge is for everyone. You have to earn the right to have access to that knowledge. I think there's a lot of wisdom in thinking about those kinds of models. I know that in the US, and especially even in my field, we are just like strung out on the idea of open access and open data. But of course, that is a model that emanates largely from communities who don't live under surveillance, for whom that seems like a perfectly reasonable and logical way to organize information. A patient should, and of course now we have in California, Jonathan Porat of the California Technology Officer just announced, I think in December, that we will be able to, opt our own consumer data out of like data brokers and these kinds of systems, which I think is so incredibly important. We should be able to also do that, of course, with our medical records, our healthcare. So there is a tension between collecting more data and privacy, but I don't think we have to collect data in ways that it feeds into systems that harm us. What is very helpful is when, and of course, Black women's mortality during childbirth, for example, is a very important issue that other Black women would not know as an issue were it not understood in aggregate. And then, of course, the leading advocate on this issue, in fact, a Black woman just passed away 2 or 3 weeks ago in childbirth, which is a total devastation. So I think we have to figure out, how do we solve problems for groups of people that don't have to translate to their problems being inserted into large systems? And those are the kinds of things where data trusts and community level control. So we're doing a lot of work at the Center on Resilience and Digital Justice that I lead with, working with civil rights groups, for example, and really helping them understand the role they play in protecting communities. We need legislation and regulation that keeps those data trusts private and usable for people. And that also would probably mean we have some reimagining to do about healthcare delivery as well, which happens in these, again, large aggregated models, national models. I mean, UCLA Health is constantly adding clinics, for example, and like massively upskilling standards. But some of us are old enough to remember when the doctor, our doctor, was the repository of the knowledge, right? Not the AI system. So I think, these are really complex issues we're going to have to solve. They probably won't get solved with AI, but they will get solved, I think, with thoughtful people working on the kind of legislative front, the community, social movement level, the technical system and security levels. And then, I think there's also, for me, I guess living in California, I can't not think about what happens to all of our knowledge when the grid goes down, or there's a fire, or there's no power, or all the things too. So I think it's also really important that we have these knowledge systems that can persist beyond electricity or other kinds of things that might immediately thwart the whole project. It's a really good question. It's a difficult one to answer too.
Okay, so this question relates to your very last one. Reddit quote that, the future physicians are using AI. Well, I'm faculty at UCSD pharmacy here, and I have a course right now. My students said, oh yeah, we uploaded your lecture materials
Oh my gosh.
onto an AI platform
Yeah.
to allow them to get the summary
Yeah.
of what, although I do reviews for them. What is your policy at UCLA, and what's your stance on students using AI uploading faculty notes?
Well, no. That's my policy. We don't have a campus policy yet. We're constantly talking about this in larger forums of faculty. It's very, this has been an issue where you would think there's more of a divide among the faculty. Our North Campus faculty were like the humanities, social science, arts faculty, and our South Campus are the engineering and medicine faculty, life science faculty, geographically. And you would think this would be a big issue, divide issue, but actually it's been so fascinating for me to watch my colleagues in statistics and data science and computational medicine who feel just like you. What are you doing uploading all my data sets to ChatGPT? Like, they're very concerned. I mean, obviously, we all should be concerned. My books and work have already been stolen by Anthropic and OpenAI to train their models, Oh, everybody here should be checking, too, for the lawsuit and register and see if your books and articles have been training AI models, because there's a nationwide lawsuit going on for all of our stolen intellectual property. So do that. But also, I mean, I just realized this is being recorded for television too. So also, you at home should check your stuff too. I think the policies should be, every student on campus should be taking these kind of critical AI literacy courses. We should really mandate these, and we should teach students these kinds of things and more. We have a freshman cluster course called Data, Justice, and Society that I teach in, and the exercise of just teaching the students to, for one class period of 70 minutes, close the laptop, put the phone in the bag, and be with me as I give a lecture is so stress-inducing for them. And so we are also having to teach students, and we're really committed to teaching students how to sit in a 70-minute lecture without transcribing. It's like at the airline counter. It's like, they don't have to do that. So this is the consequence of lots of policies that we have had about getting good grades, getting all the points, getting as many points as possible to get the grade, which pass the test, which has very little relationship to, are you learning? And so that tension is a tension I think everyone is grappling with, and obviously AI is making it more difficult, but we are resisting very much in trying to get students to go old school, because we're Gen X. I don't know, that's all we know how to do. Thank you.